Have you ever looked at an old photo, maybe even just from 5 years ago, and noticed that you looked a little different? You have fewer fine lines around your eyes, you have less definition around your smile, those marionette lines that people call them weren't there at that time. Have you ever thought, oh my gosh, things have changed and more quickly than I expected? Is this menopause? Is this a change of aging? What exactly is going on? Today, I have Dr. Diana Ponsky to talk about all of this with us. She's a renowned facial plastic surgeon in Cleveland, Ohio, double board certified by the American Board of Facial Plastic Reconstructive Surgery and the American Board of ENT. She's the former director of the Division of Facial Plastic and Reconstructive Surgery at University Hospitals Cleveland Medical Center. She's an assistant professor at Case Western Reserve University in ENT, otolaryngology, and plastic surgery. She is a wonderful individual, and I'm so excited for you to hear from her today. Welcome, everyone. As you just heard, my guest today is Dr. Diana Ponsky, and you heard her incredible credentials already. So, as a facial plastic surgeon, I wanted to have Dr. Ponsky on today to ask her about where she sees perimenopause and menopause showing up in her field of work. As we've talked before, we have estrogen receptors in our entire body, and I know that she sees it at her work. So I wanted her to share with you all what she sees. So thanks so much for being here, Dr. Ponsky. I'm so happy to have your time and so lucky to have your time for all of our listeners.
Thanks so much, Rachel. I'm honored to be here, and I think our, collective conversations can help some of our patients learn a little bit more about their process of aging and their perimenopausal and menopausal journey. In my practice, it's interesting. I take a lot of photos over the years, and I will follow patients for like 8 years at a time. And it's really interesting that I can pinpoint the exact time when I think like they've hit menopause because
Wow.
there are certain changes that you can see. And the patients will tell me, they will say, gosh, my skin's coarser. Like no matter what I do, it just really doesn't improve. I've got all these brown spots, things like to wipe the corner of my mouth because things feel like they're, dragging down. And it's through my patients that I'm, learning these things that we do things to slow down the process.
I love that. Well, I'm a big believer in preventive medicine, and I think preventive surgery also has a place. But I would love to hear more about what things you're noticing because I know for myself, I can look at my hospital badge from 5 years ago and I'm like, oh gosh, things changed. I had a baby, I went through postpartum period, and now I'm entering perimenopause, and I can see some changes, but I think your eye is so much more attuned. You've got this expert eye to see those changes. What are you seeing specifically?
Yeah, yeah. So it's not just me, actually. It's the fact that we have iPhones, right? And now we're more heavily studied. Everybody's more tuned to their faces because they've studied their photos over the years.
Yeah.
Classically, we knew how the body changed in the Middle Ages and all that, but now we can actually study and pinpoint faces. Usual things, our skin gets laxer, we lose facial volume. Our jawbone down here gets shorter and becomes much more square, or we call it masculine. Our brows no longer, if you look at pictures of older women, we lose our arches over time. So that hot, nice, arch
I
becomes
didn't know
more
that.
masculine. Yes, over
Oh,
time it's flatter.
okay.
And so
Now I'm
so
looking
there
at
are
my eyebrows.
there, there are minor things, and then there are things that are more noticeable. And I think it's harder to see in yourself, but if you
Yeah.
look at pictures of women through decades, you'll notice it. It's all a descent, gravitational skin descent, fat descent, and then atrophy of certain fat groups in the face and
Okay.
how they gravitate downwards.
Oh my gosh. Okay. And so that's why people do all these things to lift, right? Like the facelift. That's the only thing I know as a gynecologist. And so that's why I wanted to have you on here to tell us more. I know it's more than just a facelift.
Sure, sure. So not just lifting, like the lifting, you can get the skin, right? You can shrink up the skin size because it expands as we get older. But then you can do the lifting and cut off excess skin. Doing that, you also lift muscle groups, right?
Okay.
And then you can also reposition certain fat. But it's not just a one thing, it's gradual. Just like we exercise daily to
Right.
tone our muscles and to keep it as healthy as it can be. That's why we do resistant exercises and stuff like that. So you can't just say, okay, at 60, I'm going to do a facelift and then I'm done for,
Right.
whatever. It's a constant conditioning, basically, of all components components. And I think that's the part that we're just starting to realize that it's just not one thing. Just like you don't fix your car once and that's it. You have to
Right.
tune it up. Yeah, do little maintenance checks throughout.
I love that analogy. I mean, I've done some of my own preventive work. I don't know if I've told you, or maybe I've told you a while ago. I wanted to do a blepharoplasty because I look at my family members, they're all gorgeous, but I see the what's coming down the road for me
Right.
through seeing older family members. I'm like, it's just genetics, right? I wanted to have a blepharoplasty after watching a show and seeing, okay, that's what I need to do to prevent the eye sagging. And then I talked to a facial plastic surgeon who told me actually to do a lift, like a
Brow
brow
lift.
lift,
Uh-huh.
right? And then they put fat underneath my eyes so that I wouldn't look like I always have bags under my eyes. And I thought that was really helpful as a big preventive move, but you're absolutely right. The maintenance after that, you still need to do more than just, one thing. So I'm assuming it's not one size fits all, that every patient is different, but how would someone go about thinking through like what's the big preventive thing and then what's the maintenance that they should be thinking about?
Sure. So I think, you honed in on the important part where like you saw yourself, you saw your family members who are older than yourself, and you can tell that you're related to them. So you're going to go through a
Right.
similar journey. And so that's very important. And doing it earlier will give you many more years of it lasting, right? So the part where not everybody has the same degree or the same journey in aging is the most important thing. So you are correct. Some people just have an upper eyelid lift, but some people whose brows have fallen prematurely because of frowning, of concern, of, just genetics, that may be the better surgery for them. And so you do want someone who's an expert in the face to help you with that query or that question.
Yeah.
And for me, like I have had things done too. So in my family, it's upper eyelid skin. And then genetically, as an Asian, I do know that I'm going to get puffier in my under eye area as I get older. So unlike you, who
Yeah.
had some hollowing, I'm
Yeah.
going to need fat taken out, in the future. And so we're all very individual, and ethnically that all plays a role too. In terms of, let's say, maintenance, right? For me, it's about the skincare. It's about staying away from the sun so I don't get brown spots. I know that genetically I'm going to get more evenness of skin tone because of my Asian background.
Mhm.
So I will do things to prevent it. I'll use sunblock every day. I'll
Okay.
use creams that will make my skin health the best it can be. I will also make sure that I will do laser treatments and chemical
Okay.
peels much more than others because I know that's coming down the road for me. With menopause, like we know that within 5 years, 30% of our collagens deplete.
Oh
And
my
then it's
gosh. That's a
yes,
lot.
in the 5 years around, yeah, it's menopause, 30% of our collagen will deplete, and
Yeah.
then 2% each year thereafter. And
Wow.
so that's why it's almost like a switch that you like one day notice, oh my gosh, my skin is not the same, glowy skin that it used to be,
Right.
and things are sagging. So it's just about prevention and what's coming down the road.
That's so interesting. And so some of that prevention is not necessarily surgical, like some of it is, right? There's some structural changes that however much skin cream you can try is not going to stop the sagging of my eyes, right? So some
Right.
of that is surgical, and then some of it sounds like sort of skincare. And then I wonder what you think about the role of hormones for people.
Yeah, so I'm a big believer in it because we both know that, we can't completely prevent things, but we can slow it down. So I like to explain to my patient if I had an identical twin and I didn't do all the things, good skincare, good sunblock, all that, and my twin did, we would look like 10 years different after a certain number of time had passed. And we
Right.
know this because we've done twin studies over the years
Oh,
where
cool. Okay.
certain lifestyle habits, smoking, drinking, sun exposure, all that make a difference. So to your question of hormones, I think we know that there are estrogen receptors throughout our body, especially in our skin. And so those receptors, I don't actually know if they change. You'll know more about that. But I know that the circulating estrogen,
Yeah.
that changes, right? And
Right.
so that's how you'll see skin changes, mucosal changes, hair changes, things like that. And being able to start hormone replacement therapy earlier is a game changer. I think,
Yeah.
for myself, I've consulted with you to get on hormone replacement therapy even before I'm at menopausal times. And
Yeah.
so that's just to make sure that I stay on top of my muscle mass, my fat redistribution. It goes from
Right.
our face to our mid part. And so
Right, right. It's true. That's true. And I love that you're mentioning starting earlier rather than later, because again, if we're talking about prevention, we're talking about doing things to slow down. So, aging is inevitable. We all want to age gracefully. And I think what gracefully means is like slower, right? And less of that acute switch. I love this that you say that you see this switch happen in people because I think that's got to be that depletion of the collagen, the depletion of estrogen, and maybe the depletion of testosterone too. And if we can slow it all down through medication and treatment, then that would be a good thing, I would think. Then your body's not going through such a huge change too, right? Like I guess if you're losing a lot of muscle quickly, it's going to be more visible everywhere else other than a slow, gradual loss.
No, for sure. And it starts with educating. And I think,
Yeah.
we're at a great time in our society right now where science is advancing rapidly. And the things that we're learning include different silos, like we're collaborative rather than in our little individual silos. And so I learn a lot from you. And I think, because we see the human body reflect all these like hormonal fluctuations and differences everywhere, muscle mass, bone density, all of
Exactly.
that. So,
And you
uh,
mentioned smoking. I mean, I see the difference in smoking for my patients. And if I'm going to do a reconstructive, like vaginal surgery for someone, I do tell them I'm not going to operate unless you've quit smoking for 6 weeks before surgery and at least a month after, because otherwise it's not going to heal. You see
completely.
those changes in smoking in the face too?
Yes, definitely. Luckily for me, I think smoking is becoming less of an entity, mainly because of lip lines, right? People see their lip lines and
Yeah.
they know that smoking contributes to its exacerbation, but so does
Okay.
using straws and things like that.
Okay.
From a healing standpoint, the face,
Straws.
we
I
we
didn't think about, I never thought about straws as a hazard. Not only are they not environmentally friendly, but they're a hazard for your face. I
it's
don't know.
repeated motions of
Got
anything.
it.
And so
Watch out, all those Stanley cups. That's
I know.
interesting tidbit there. I learned.
Yes. So for sure, it is lifestyle, things that contribute. And I have the same parameters. Mine's a little bit more lenient. I do 4 weeks before, 4 weeks after, but
Okay.
essentially it's the same. And it's because we want the best healing process for the patient.
Yeah.
And these are important things. Your
Yeah.
vaginal reconstruction, it's hard to do it a second time. And so
Exactly.
you definitely want to enable your patients to have the best recovery possible.
Tell me about all of the things that women should be thinking of if, okay, say they missed out on the prevention, maybe they can't use hormones, or maybe they're just now coming to a point in their life where they've got time and resources for themselves. And, they see that the aging has already shown up, they see the hormonal changes are already there. What can they do? Is it too late for them?
It's never too late, right? Because right now we're living to what, 105, 100 something. And so in the next few years, it may be 120. And so I always say it's never too late to get started. Honestly, there are other ways around it. You may need somewhat of a more aggressive treatment. So let's say
Yeah.
you've been a sun worshiper all these years because you just didn't know. And now you're like, I want to take care of my skin, get my wrinkles and dark spots better. It
Mhm.
would be a little bit more of an intense therapy. We
Yeah.
might have bigger, more deeper lasers applied to them and then
Okay.
get them on a skincare program. We might talk about fat transfer to combat fat and muscle atrophy, and then also get you on a maintenance program. So it just means there are more things that, that we might have to do in the initial get-go. But if they're
Okay.
committed to a care program, a maintenance and, care of their facial skin program, that really helps. And it comes with also nutrition. It's not just like this and all the creams in
Mhm.
the world will help you, but you're still not eating healthily or,
Right.
exercising. Everything is tied in together. So.
Can you tell us, maybe this is just my own selfish question, what is the role for fillers? Because I've never quite understood like when people should be using fillers or looking for them.
So that's a great question. Fillers are a volumizing agent that
Okay.
is synthetically created to mimic what our own body makes. So
Okay.
hyaluronic acid is the most common one,
Mhm.
but there are other types of fillers and they volumize. They don't lift, and somewhere along the way,
Mhm.
the distortion happened, whether it's through, advertising or what. But if you volumize enough, yes, you can give the illusion that you're lifting, right? So if I'm putting fillers in my cheeks and I
Yeah.
blow it up enough, then it seems like it's lifting the other tissues,
Oh,
but it's not.
yeah.
And so it will plump up something that is coming more deflated. And don't get me wrong, I think there's great role for fillers in certain
Okay.
areas. It's just that I feel currently it's used too much. It's
Mhm.
being used not always in the right way. And we are learning that the product does a little bit more than what we knew in the beginning, which is
Yeah.
that it stays around, infiltrates into muscles. It can sometimes, let's say for the mid cheek, it can
Yeah.
distort the ability of that muscle to fully function. So the smiles are off because this
Right.
is like so full.
You can't move them. Is that what you're saying?
Exactly. It's
Okay.
infiltrating into those muscle fibers. And
Yeah.
so it's not allowing adequate room for movement.
Okay, that's so interesting. And I think that's why you're so special, honestly. Like you have this ENT and plastics training. So you understand the musculature as well as like the surface. That's at least how I think of you.
Oh, thank you for that.
I mean, that's really important. And I've noticed the differences even of just having Botox in my forehead from someone who has training like yours compared to like going to a med spa. I feel like it's completely different. And I think, well, you can
Mhm.
see my Botox is wearing off, but like I think when somebody understands the musculature, it's just done differently. And I think it makes more sense to have
Yeah.
someone with expertise like you to take care of a person's face.
Yeah, no, I appreciate that. Those years of training, you got to put it into some use, right?
Absolutely, absolutely.
Yeah.
Okay, so what about nutrition? And, we talked about lifestyle and things like that. Do you see a role for things like collagen or these other supplements? I know we've done some social media videos because you
Mhm.
see these things being added to like drinks and beverages, and like everybody wants to sell something with an added supplement these days. Is there a role for making supplemental collagen, do you see, or what do you think about that stuff?
So there's a role for health and natural foods giving you the supplements that you need.
Yeah.
Collagen is essentially created by our fibroblasts, right? And if you imbibe, if you drink, if you take collagen, that doesn't mean that it's being created in your body the same way. Now,
Mhm.
can you pull nutrients from these supplements? Because it's not just the collagen, right? It's
Right.
probably some components of the building block. Yes, it may help you, but it's not proven direct correlation or direct science.
Actually replace.
Uh, exactly. It's sort of like when you build a car, right? Just because you throw extra tires at it doesn't mean that it's going to make itself into a car with four wheels. It's
Right.
just a building block of what you need to make collagen. So I don't know that all the science is there to support
Mhm.
their claims. I don't see it doing major harm, except for some of those IV infusions. We got to be
Mm.
careful of those IV
Okay.
infusions that have peptides and growth factors and things. Make sure
Oh,
that they're
perhaps.
compatible with your system. But,
Okay.
collagen that you drink, collagen pills that you take, I don't see as harmful. So if it helps you get some building blocks, sure, but it's not going to automatically translate to collagen for your system
That
right away.
makes sense. That
Yeah.
makes sense. And then, of course, sunscreen, another good preventive for everybody.
Yes.
And then what would you suggest for people? You mentioned like kind of different ethnicity, different backgrounds. I think that's really interesting. How could people figure out what makes sense for them individually?
Right. So aging is very individual as well as very genetically based. And so
Yeah.
if you see, what your parents are going through, so I can tell you what's in my future, based on looking at my mom and dad and my aunt and all that. And also the Asian race where like the chubby cheeks become more of an entity and the short jaws. You just have to kind of pay attention, I guess, but also because we've studied it, I can tell you that someone who's blonde, blue-eyed will age faster from a skin standpoint, but their bony health would be better than a Asian. So for instance,
Interesting.
we
Okay.
talk about osteoporosis, right,
Right.
in the
Right.
long bone, but
Mhm.
osteoporosis also happens in the facial bones, so the jaw bones, around the nose,
Oh my
certain things. And
goodness.
so
Yeah.
if you take my heritage, I can tell you that my jaw, my chin is going to recede faster because the
Mhm.
bony changes than my soft tissue. Whereas if I take a friend who's blonde, blue-eyed, I can tell you that her skin's going to need a lot more work to combat the aging because she'll develop lines faster, even if she's the best at wearing sunscreen or so.
Hmm.
So the lines etch in more, the skin ages faster, but yet
Yeah.
her cheekbones and her jawbone will withstand time faster than mine will.
That is so interesting. And that's another, honestly, sorry, not to just talk about hormones again, but it's another role for hormones. If you can take estrogen, that's going to help prevent osteoporosis. And
For
like you
sure.
said, we are living longer than ever before. So we're living after menopause, after we have estrogen circulating for longer than ever before. Some of the, statistics I've seen, 30 to 40% of our life now is being spent after menopause. And so
Wow.
you think about that as a time where you don't have circulating estrogen and we start to lose our bone density,
Yeah.
right? Then like we're only in a lost state. Wow, I had never thought about the small bones of the face. That's so interesting.
That speaks to, learning about your hormone stores and getting on them earlier,
Yeah,
for sure.
exactly. My
Yeah.
last question for you, if you don't mind, unless there's something else, but I was thinking, what about people who are listening to this and say, like, we shouldn't try to put off aging. This is a natural part of life. Like, let's just go with it. I mean, I try really hard not to be an ageist, right? I think that's also important,
Yeah.
but I feel like I don't want to give the perception that we all are trying to get to this fountain of youth. So how do you reconcile those two things? Or
It's a tough question, and I think it boils down to your philosophy on how you want to approach it. And I hear you. I hear that all the time too. I'm just going to age gracefully.
Mhm.
But it means different things for different, people, right? So if I know that in my future, I'll bring it back to the things that I do to keep
Yeah,
my physical health, not just as it pertains to what I do in the face.
yeah,
But like for instance, I mentioned that I take hormone placement patches, pills. I'm doing prevention for my hair because I know that's coming down the road. And so I take a subtherapeutic minoxidil pill to curb the hair loss that I know I'm going to start to see. I also eat very healthy. I walk a lot and I try to exercise more regularly on resistance training. But
yeah,
on that same line, I'll do PT for my lower vaginal portion because I know I had 3 kids. They were
yeah,
all vaginally delivered. I know my pelvic floor is going to stretch and not be as healthy as it can be. And so
yeah,
these are things that like I know is headed down the road because
yeah,
mainly because I see it in our patients, right? Their complaints, their worries. And so I want to do everything to make sure that I can help myself along the journey until
yeah,
something happens. Like, God forbid I fall and break a bone. The fact that I have better muscle girth is going to help me recover faster.
absolutely.
And so it's all those things that will like propel you. Like if you had a car and you didn't take care of it, your
Yeah.
maintenance is going to be longer, it'll be more drastic, and there'll
Mhm.
be rust and things like that. Whereas if you took care of it along the way, it is eventually going to fall apart, but
Yeah.
hopefully the repairs will be less intense. The same reason you take care of your house, right? You're not
Yes.
going to let it go naturally to a state of, decrepitness. You're going to make
Mhm.
sure that the leaves don't collect in certain areas and wear things down. And that's my approach to it. I feel
Yeah.
like everyone's different. You can just leave things alone, but your body just still needs tending to, just like
Yeah.
everything else. You buy different clothes, you don't wear the same clothes you've had through,
Right.
like since your 30s. I mean, some people may, but like you usually
Yeah.
want to renew things and to, take care of yourself in that way. And so I
Yeah.
think this is just a natural translation of it. It's not vain, it's
Absolutely.
just we are living longer. And so we've got to keep our bodies working for us longer. So,
Yeah, I love that. Well, thank you so much for your time. I learned a lot of interesting things today, and I'm sure that our listeners did too. And really appreciate all of your words of wisdom and your advice. And definitely, if you're in the Cleveland area, I would encourage you to make an appointment with Dr. Ponsky and get your own individualized plan. Thanks for being such a role model of just, a physician, entrepreneur, and someone who takes care of themselves. I was thinking as you're talking that for so many of us physicians, we actually don't do a great job of taking care of ourselves. But I loved hearing your example of all these different body systems and organ systems where you are thinking about your long-term health and, trying to put in intentional care of them. I think all need to do that. So,
yeah.
but
I
thank
agree.
you.
It's such an honor to speak with you, Rachel, and to learn from your field. And I think menopause has had such a, I guess, we've not really been aware of all the
Yeah,
changes that the female or spoken about it publicly. And I
right.
think we're reaching a whole new era where we are learning to take care of our menopausal and postmenopausal and perimenopausal selves a little bit
Yeah.
better. I think women need to do that. If you're at a point where your childcare things are done, right? Taking care of your kids, and now you have to focus on taking care of yourself before you have to take care of your parents and that
That's
whole
right. Until it
journey.
flips again. That's right. That's right.
Yep.
Well, thank you so
Awesome.
much
All right.
and to have you back sometime to talk about more topics.
All right. My pleasure. Thank you so much.